We're going to be working on the budget recommendations for Kansas Department of Aging and Disability Services. And so we'll go ahead and open that up and start this out. It's a two-year budget. We're finishing up fiscal year 23 and going to 24. So I know they're probably not a lot for 23, but let's look at those first by themselves. Are there recommendations for fiscal year 23? I do. Oh, Representative Ruiz.
Do you have one? I'm recommending adding $5 million to establish a patient observation reimbursement program to be used for unreimbursed patient observation and transportation. The funds will be used by healthcare, law enforcement, and other county entities. For 2023.
Is there a second on this? Second, Representative Ballard. Representative Carpenter?
Thank you, Mr. Chair. So, Representative Ruiz, so we're almost out of 23, and there won't be any funds dispersed until probably May or June, so.
It'd be 2024 then.
Okay, so just,
Yes.
can we hold that till 2024?
Perfect.
Thank you.
Thank you for the reminder. I forget what month we're in. Thank you.
Yes, we have just a few short months left, and by the time we finish up session and things become law, then we're really just doing the revisions for 23. So are there others for 23 before we move on? I do have one quick one, and this regards a company based out of Newton, Kansas, and they have units throughout the state. And they provide services for those with opioid use disorder. And through a mix-up, they're about $1.9 million behind from their services reimbursement from KDADS. And so for fiscal year 2023, I'm recommending that we add $1.9 million SGF and direct KDADS to reimburse Mirror Incorporated to fund services to clients with opioid use disorder.
Chairman, I'll second.
We have a second from Representative Clifford. Committee discussion? Seeing none, I'll go ahead and renew my motion, and all those in favor indicate by saying aye.
Aye.
Those opposed, no. Seeing none. Any other recommendations for fiscal year 23? Seeing none, we'll move to fiscal year 24. Are there recommendations? Representative Hobson.
Thank you, Mr. Chairman. I'd like to add language directing KDAD to fund the Amber Hope Youthville PRTF pilot project at $1 million for existing resources for fiscal year 2024.
Is there a second? Representative Ballard seconds. Discussion?
Mr. Chairman, I might elaborate on that a little bit.
Please do.
We started this pilot program. Amber Hope has spent a lot of money. They are a very well-operated PRTF program in Newton. And this money, this year, it's in the governor's budget. The $1 million is in there, but it doesn't necessarily define the fact that it may be used for another PRTF program. And Amber Hope has spent a lot of money on that with that $1 million and has a lot of investment in that program, and we need to make sure that that program is funded for them. That's the basic definition.
Thank you, Representative. Committee, other discussion? Yes. Representative Ballard.
I would agree. You know, we were impressed last year and they did well, and it's kind of nice to continue with it. Thank you, Mr.
Other discussion, committee? Seeing none, Representative Hobson, would you like to close, elaborate, and then close?
No, thank you, Mr. Chairman. I close.
All right. Those in favor indicate by saying aye.
Aye.
Opposed, no. Okay, that funding is approved. Committee, other recommendations? Representative Clifford.
Thank you, Mr. Chairman. Mr. Chairman, I'd like to add enhancement for $400,000, all SGF, for sustainable operating support to assist in vision families, programs and advocacy efforts for the blind and visually impaired, for blind and visually impaired children.
Do we have a second? Representative Ballard. Committee discussion on this. Representative Ballard.
Yes, I had this one down as well. I think if you remember, I think one of the conferees who came there talked about early childhood 0 to 5, visually impaired. And generally at that age, parents don't know quite how to handle the situation. And I remember asking her what was the best part of her job, and she said working with parents to get used to this and not to feel like there's no help out there for you, and working with the parents and the siblings to make it sort of more normal than something that cannot happen. So that's why. Thank you.
Yes, committee, other discussion? And I think it's important to note that this was just an ask for 1 year. We don't expect this to necessarily be an ongoing thing, but this is a one-time expenditure to help them with their daycare and things like that for the visually impaired. Is that correct?
That's correct, Mr. Chairman.
Okay. All right. Any other discussion, committee? Seeing none. Representative Clifford.
Yeah, thank you, Mr. Chairman. And I agree with Representative Ballard. I mean, if I've made these diagnoses of children in the hospital, and it is bewildering for parents. They don't know where to go, and it's great we have this access to Envision. So I move my amendment.
Committee, you've heard the motion by Representative Clifford. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion passes. Committee, other recommendations? Representative Ballard.
Thank you, Mr. Chairman. Basically, $2 million. Even though it's being asked by Independence, Inc., it's really for Interhap, excuse me, it's for any organization that works with Kansans with intellectual and developmental disabilities. And part of it was to request funding for crisis services, more as pilots that will help them develop program standards, being able to, whether it's mental health or a crisis plan, best practice, or whatever, but partially, most of it is crisis support programs in order to get them over whatever problems they may have, especially around intellectual and developmental disability. And they're requesting the $2 million in grants plus $93,000 in salary and fringe benefits for one full-time KDADS person to monitor this program.
Committee, we have a motion by Representative Ballard. Is there a second? Representative Wahhabison. Discussion. Seeing none.
Mr. Chairman, just a question. So is this of necessity all SGF? I mean, you can't draw down funds from somewhere to help support this? Just curious. Anybody know?
Representative Ballard.
I think one of the things that we've been doing this year is looking to see, can we get a federal match? And I haven't heard anything about it, but should that occur, they'll probably come back and let us know that you could have so much in SGF and so much was federal. But right now, I don't see that happen. And personally, I didn't ask about that because a lot of this is within the KDAD's budget.
Okay, thank you, Mr. Chairman, and Representative Ballard, thank you for your explanation.
Representative Barth.
Thank you, Mr. Chair. This budget request for this is something that I brought up with a question as well. It addresses some of the prison issues that we have with people being stuck in a prison who really need to be in a health facility that is of a certain level to be able to provide them services. I think I'm on the right one right now. Correct. Yes. So this, I believe, would help with that problem. And this exists in my district within Miami County because they house patients from outside other counties in addition to people from Miami County that are coming from the OSH facility as well. So this is, I think this money would, help address some of those issues and challenges as well.
Representative Ruiz.
I totally agree with Representative Barth. And the other thing is, when we're looking at the crisis intervention kind of services and we're looking at these mobile teams being created, the folks that mostly do crisis work are all in mental health, and they lack a lot of experience and knowledge in interventions that would be appropriate for those with an intellectual disability, and this will help do some cross-training so that the interventions would be much more appropriate for someone who has an intellectual disability and or duly diagnosed also with a mental illness, and being able to find the appropriate interventions for them.
Committee, other discussion? Seeing none, Representative, you may close.
Thank you, Mr. Chairman. I close.
You've heard the motion by Representative Ballard. All in favor indicate by saying aye.
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 Opposed, no. Motion passes. Are there other recommendations? Representative Ruiz.
Go back to the one I tried to do for 23. For 24. Add $5 million to reimburse healthcare, law enforcement, and counties on an hourly basis for patient observation and transportation after evaluation and approval to stay at a state mental health hospital and admission to the state hospital. This was brought to us by the Kansas Mental Health Coalition and Advent Health Shawnee Mission. I've seen for myself, I know the cost that comes to when a person is awaiting transport to a more structured, restrictive environment, and they're in the ER and in a hospital, and it does take a lot more personnel to be able to be with them, and all of that is unreimbursed, and I think we have seen the costs added up. Law enforcement is also having to provide transportation, and no one is getting any kind of reimbursement for that. So I think this was very much needed.
Okay.
Thank you, Mr. Chair.
Your motion is for $5 million.
Yes.
We have a second for that.
Yes.
Ballard. Discussion, committee. Representative Clifford.
Chairman, I wholeheartedly agree with this. I wonder if it'll be enough, but I guess we'll get some data on how many requests are out there. I have a jail, I have a hospital, I have a community mental health center, all of whom are struggling with this, and I'm very supportive of this enhancement.
Very well. Committee, other discussion? Seeing none. You've heard the motion. All in favor indicate by saying aye.
Aye.
Opposed, no. Motion passes. Committee, other recommendations. Representative Ballard.
Thank you, Mr. Chairman. I think we talked a lot about 14C, and that's in many ways that sub-minimum wage looks like, we need to do better than that. Kansas is pretty far behind. Additionally, CMS, the Center for Medicare, has a new final rule greatly limiting the ability to use Medicaid dollars about this. But the whole idea is put them in an integrated setting so that they're not just in the work environment that they're in with lower wages, but they can work and do a lot more if we allow them the training and the ability to really do more. And so these grants are for time limited. It doesn't go on and on. Very few Kansas providers, only about 24 have 14C certificates. This will be a voluntary program, but it would help Kansas provide more transition that is really needed to make sure that person with disabilities are able to integrate more. And it's called New Disability Employment Transition Innovation Grant Program, and it is $1 million.
You've heard the motion. Is there a second? Representative Hobson. Committee discussion. Representative Carpenter.
Thank you, Mr. Chair. Just some questions about this. So will this do away with the programs that we now have? Is this the same one that we have a bill for that allows some of these folks to set up a separate entity to provide that?
I don't think it'll do with that program. I think it's in addition to that, but the state grant program would assist providers in making the transition to a new business model.
And I'm wondering if that isn't the new business model that we're talking about.
You know, I don't think so, but part of what it is, I think when we talk about the new community support waiver, I think in many ways, that's what, maybe 2.5 years off. I think it would provide workforce supportive employment in addition to what we're doing.
Okay, just curious.
Now, Representative Clifford.
Thank you, Mr. Chairman. Since this is a grant funding program, I just have a question of whether is it $200,000 a year for 5 years, or we award in 2024 the million, and then the agency grant, you know, are we giving them a deadline because it's in the 2024 year for a 5-year grant program, or, you know, do they just carry it forward? Or do we leave it up to the agency, I guess is my question.
We're leaving it up. Oh, I'm sorry, Mayor. I think we're leaving it up to the agency because it says innovation grants would support 14C sub-minimum wage certificate holders in Kansas to voluntarily transition to competitive. These are not ongoing expenditures. These grants are for time-limited, finite period of time to assist providers in making this one-time transition.
Thank you.
So, Representative Ballard, it's not necessarily like a study that they're conducting. They're actually trying to provide grants to the 214C holders to encourage them to abandon that model. Is this what you're saying?
And make it more integrated.
Okay. Representative Ruiz.
One of the things we heard from the Disability Rights Center of Kansas is there is a bill in Congress now that might get passed this session for them it is going to, in fact, do the same because they're encouraging the 14C businesses to transition away from it. So it's not cutting them off at the legs, but it is asking them to transition. And so the feds are going to start providing funding, but that is going to be further down the road. What we're asking, and what they're asking, is that we start providing that funding now so that the 14C agencies that we have in Kansas, and there's 12 or so of them, 24, that they can start now and not wait for that bill to hit from Congress, but they can start now to do the transition away from a 14C.
Representative, do we have any evidence, anecdotal or otherwise, that would indicate the 214C holders would voluntarily move away from that?
Well, I will comment on that. You know, thank you so much. If I'm slow today, I apologize. I really have an awful headache. But when I'm looking at this, it's like it is transformation to Competitive Integrated Employment Act, okay, which phases out 14C minimum wages. Looks like it's going to become, but if this organization includes a little bit of money for grants for states to make the transition, but the federal money will not be enough. Additionally, that's that new rule that's set in. And I think what we're going to the more integrated model. And I think the part that impressed me was insist providers in making the transition to a new business model to employ and support people with disabilities in competitive integrated employment. And I don't know if that's enough, but it's in addition to what we want. But I think what we're looking more at with people with disabilities, that they become more competitive. That means you pay them more, you're going to train them more. And then I think they can realize their potential.
Representative Carpenter.
Thank you, Mr. Chairman. And my only deal is sheltered workshops perform a great function with folks because they will be at home, they'll take them there, they interact with folks. So I just don't want this to be something that outlaws. I see it's voluntary and I'm okay with that. So, but sheltered workshops they get a bad rap, but they do perform a good function, a
I
great
agree.
function. Thank you.
Thank you, Mr. Chairman.
Yes, and they've been operating under the U.S. Department of Labor, that rule, to allow them to do this for some time. And I would say at such time that the federal government rescinds that, then, that would certainly bring it to an end. But, okay, is there other discussion on this amendment? Seeing none. You've heard the motion. All in favor indicate by saying aye.
Aye.
Opposed, no. Okay, motion passes. Committee, other recommendations? Representative O'Hobson.
Thank you, Mr. Chairman. I would like to add $3 million from the SGF for senior nutrition services for fiscal year 2024.
Representative Carpenter seconds, right? Did I hear that correctly? Okay. All right, you've heard the motion. Any discussion? Representative Hobson, would you like to just elaborate on the motion and what they do?
It's the $1.5 million from the ARPA funds added to the nutrition services in 2003 will run out during the 2004, during fiscal year 2024.
And this will allow them to continue operating the
Yeah.
meal service? Yeah. Okay. Committee discussion. Seeing none, you care to close?
Thank you, Mr. Chairman. I close.
You've heard the motion by Representative Hobson. All in favor indicate by saying aye.
Aye.
Opposed, no. Motion passes. Committee, other recommendations? Representative Ballard.
Thank you. We have one where we're talking about Kansas for CMHCs, but for the certified community behavioral health centers, they have to have certain training. And there's some that if they've already completed their training, they shouldn't have to just wait. We should be able to go on and certify them. And some of the language that says during the fiscal year, in addition to the other purposes for which expenditures may be made by the above, the money is appropriated, that such agency shall certify as a certified community behavioral health clinic any health community mental health center licensed by such agency that provides the following services, that when they complete their certification, that we should be able to go on and certify them and they not have to wait any longer.
My understanding is that's for both fiscal years 23.
23 and 24, yes.
Committee, is there a second? Representative Ruiz seconds. And just as a further elaboration, so this would allow the community mental health centers to be certified as they are ready. There's a statutory cap of 9, I believe, if I'm going by memory. But this would indicate that as those centers are ready, then the department should certify them as they are ready. Discussion, committee? Representative Clifford.
Yes, thank you, Mr. Chairman. Last week, you heard from Lisa Southern from Compass Behavioral Health, who's one of our Western Kansas superstars, and they were born ready to do this. They're not one of the original 9, so I really like this flexibility and certainly totally in favor of it.
Okay. Committee, other discussion on the proviso? Seeing none, Representative Ballard, do you wish to close?
Yes, thank you, Mr. Chairman. I close.
You've heard the motion by Representative Ballard to amend with the provisos for fiscal year 23 and 24. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion carries. Now, with that is a little bit of spending, so I would go ahead and make the motion. The request was to accelerate the CCBHC transition certification based on readiness, and that's at $24.3 million all funds, 9.7 state general funds, and that would be for fiscal year 2024. So I would make that motion. Representative Ballard seconds. Committee discussion? Seeing none, I'll renew my motion to amend. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion passes. Committee, other recommendations? Representative Ruiz.
Add 7.3 million, including 2.9 million SGF, to increase IDD targeted case management rate to $75 an hour.
Committee, you've heard the motion. Is there a second? Representative Ballard seconds. Representative Ruiz, would you care to elaborate and explain that a little more?
Yes, the targeted case management is one of those services that doesn't get enough attention, doesn't get enough credit. And it is one that many agencies are starting to fold because they're not able to have been able to reimburse enough to keep staff. But targeted case management is really one-on-one direct service with a whoever the client is and wherever they live. And it is, not only do they help them navigate the system, but they help the individual, really come to an awareness of who they are, what they can do, and perhaps these might be, it might be some individuals who end up being able to get to, I guess, get better in their own managing of symptoms, that maybe they will be able to seek employment. There are just so many day-to-day things that many people need assistance with to even go to work. And targeted case managers, that's so much of the work that they do. And we've heard so much about the wait list, and I just feel that this is one way that we can help those individuals that are on this wait list and get, services now rather than us, waiting. We're starting to see the light at the end of the tunnel with the studies that we're doing and studying the wait list, but I think this would add so much more to people who have these case managers, and they've established relationships with them. They've established a sense of security with them, and then to see case managers leave the profession because the salaries are so low. Yeah, I think they're our unsung heroes, these targeted case managers.
Very well. And would you restate the numbers, please, the dollar amount?
At 7.3 million, and that's including 2.9 million SGF.
And that does get us to $75 an hour?
That's what we've been told.
If I might, I'm trying to think, the governor has it in her budget, I think, at 54.
Yes, at 54 point something.
You're talking about an additional beyond what the
Yes,
governor said.
because it's there, so it's an additional $21.
Yes.
But the thing about it is, can care, we hear about that, and we've been able to see testimony that they've lost their case managers, and it's really difficult because they start all over again and everything else, and so, woo, bless you over there. Wow, she was serious about it. You really liked it, huh? Yeah. No, but thank you, Mr. Chairman. I just wanted to be of support to it.
Thank you. That clears up my confusion on the numbers because I was thinking it was a 4.5 million, but the 4.5 and the difference between the governor's 1.5 is where we're talking about. Okay. Well, I can support that as the chair. Committee discussion. Seeing none. Representative Ruiz, you care to close?
I close.
Committee, you've heard the motion. All those in favor indicate by saying aye.
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 Opposed, no. Motion passes. Committee, what other recommendations might we have? Representative Clifford?
Thank you, Mr. Chairman. I'd like to propose an enhancement, increase funding for mental health first aid. This would involve $133,075, all state general fund.
Representative, was that did we have some testimony on that, or?
Yes, we did from Mr. Kessler, I believe.
Is there a second on this? Representative Ruiz. Committee, discussion? And Representative, would you mind repeating the recommendation?
It's a recommendation for $133,075, all state general funds, to increase annual funding for mental health first aid.
Okay. Pardon me, Committee, I'm getting my ducks in a row here. Okay, committee discussion. Seeing none, Representative Clifford. Oh, Representative Barth.
Can you remind me what the mental health first aid is for this budget request?
It's a teaching program that reaches out to public entities like schools in order to let citizens know, or even school nurses who are medically trained, how to deal with folks in mental health crisis. Obviously, we have places where they're stabilized, and we just asked for enhancement to provide funding for folks who are caught without a mental health bed, jails, hospital emergency rooms, community mental health centers. This is actually to take the first step in stabilizing folks in acute crisis before they hurt themselves or others.
Committee discussion. Questions? Seeing none. Representative Clifford, you will care to close?
Mr. Chairman, I close on my enhancement amendment.
You've heard the motion. All in favor indicate by saying aye.
Aye.
Opposed, no. Motion is approved. Yes, Representative Ballard.
Thank you. I just clarification. We heard a testimony from Clubhouse, and I think Clubhouse was their outreach programs, and I know we had funded them before, and I don't see the amount that they were asking. But I do remember they're coming for us. Can somebody help me on that, please?
Representative Carpenter.
Thank you, Mr. Chairman. Representative, I think what they were asking was the cap be raised. I don't know that there was a specific amount in there, but in the cap, they're funded from if you'll remember, they're funding by the lottery vending machines. Mm-hmm. I don't know what the current amount is, and I didn't hear them ask for any amount, but I think it was capped, I think at like 8.5 million or something like
I think
that.
it was there too. I looked for it. So
I think they were just asking for the cap be raised. Now, that's what I gathered from that.
yeah.
Yeah, Dayton.
Thank you, Mr. Chair. The cap is set at $8 million from the lottery vending revenue. That's all I had to add, just to clarify.
Okay. Representative Ballard?
But it was just when I went through looking at it, I had put something on the top of it, and I was just going through my notes just to see if there wasn't anything there. I mean, I'm not sure we could actually raise the cap. Because I think that was in the bill when we were doing the lottery machines and everything else. But I just wanted to just make sure we didn't miss something on that one, because they are doing some valuable work. And that's why I brought it up, but I am fine with it then.
And yes, Representative Carpenter is correct. They did not make a specific dollar request. They just did ask to expand the cap. And I don't know the answer whether we have that ability to do that or not. Okay. Committee, other recommendations? Representative Carpenter.
Thank you, Mr. Chair. I have a recommendation, establishing a pilot program for assistive living technology equipment during the fiscal year 2024. In addition to other purposes, for the expenditures may be made by the Kansas Department of Aging and Disability Services for monies appropriated from the other medical assistance account, the State General Fund. In 2024, authorized Section 74, Chapter 81, this 2002 session laws, blah, blah, blah. Anyway, for the purpose of developing and implementing a program for supportive technology under home and community-based services, provided that the aggregate total shall be at least $5 million. And just, if I may elaborate, Mr. Chairman.
Please do.
So during the interim committee with the IDD community, we realized that other states were doing some very good work with assistive technology, and I think Representative Clifford was involved in that. This money is not SGF money. This is to come out of the 10% increase in FMAP that KDADS has been drawing since the pandemic started. It was about a year into the pandemic when they started allowing for 10% more. That total is anticipated to be about $93.2 million, and we've spent like $75 million of that, so there's like $19 million that is left in that program that I'm not aware of any, and I've asked numerous times for what the department decided it wanted to do with that money. I have not gotten an answer to that, so I'm going to help them. So anyway, that's my motion from the HCBS FMAP savings.
Chairman, I'll second.
Is there a second?
Second with Clifford.
Representative Clifford. Committee, discussion. I'm not seeing any. Representative Carpenter, you care to close on your proviso?
I close.
All those in favor indicate by saying aye.
Aye.
Opposed, no.
Mr. Chairman,
Representative Hobson.
thank you. I just want to find out where I'm able to get, me and Representative don't have this sheet that, so it's kind of handy. I don't know if there's anybody can have an extra copy or a spreadsheet that has, so we can follow along.
Peyton, do you have any extra ones that you, he sent them out by email.
Thank you, Mr. Chairman.
Committee, other recommendations? Representative Carpenter.
Thank you, Mr. Chair, committee. Add language to increase the PACE Medicaid rates by 5% for 2024 while still meeting CMS rate PACE rate-setting guidelines. This would be $3 million all fund, $1.2 million SGF. I think this goes along with what we heard from the PACE program about the way their funding is tied. It's tied to nursing home occupancy. And unfortunately, in this day and age, the nursing home occupancy is going down, so their funding is going down, but their needs are going up. So I think PACE is a very good program. It keeps people in their homes. It keeps people out of nursing homes, and it's a very good program.
Second. Is there a second? Yes. Representative Ballard. Committee discussion on the Carpenter amendment.
We'll have to defend this bad boy. What was the amount again, please?
It was $3 million all funds, $1.2 million SGF for 2024.
Okay.
Committee discussion or questions? Seeing none, Representative Carpenter, you care to close?
Close.
Committee, you've heard the motion to amend. All those in favor indicate by saying aye.
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 Opposed, no. Motion passes. Other recommendations? Representative Carpenter.
Sorry, Mr. Chair. I have a little bit of a list here. Okay, the next one is add language requiring KDADs to fund a $2.5 million grant for PACE expansion in the current ARPA-S funds sent to KDAD or from the $167 million reallocated from ARPA funds. So it's $2.5 million from Sparks.
Second by Representative Hobson. Committee discussion on the motion to amend. Representative Barth.
Is this something that we had in one of the sheets from last week or from Thursday?
It was testimony from, I think it was Midland Care, Sean Sullivan. They asked for this last year, and a lot of the ARPA funds haven't been doled out yet, so they're asking for it again.
Representative Clifford.
This question, Mr. Chairman, so this reallocation is $23 allocated to 24, or will it be spent before the end of the fiscal year?
Yeah, I don't know that it's $23 either. It's in the federal money that we've received, so it's not, I'm not sure where that money is. It's not in the budget. What, Dayton? Okay, so they're formulating a grant program, I guess, for this. You remember how the process was? Everybody put their grants in, and it's in the process, and none of that money, or a lot of that money hasn't been distributed.
So there'll be flexibility in the budget to, or it's outside the budget?
Yeah, it's not SGF money.
Thank you. Thank you.
Thank you.
Representative Carpenter, and thank you, Mr. Chairman.
Committee, other discussion? Representative Carpenter.
I close.
You've heard the motion by Representative Carpenter to amend. All in favor signify by saying aye.
Aye.
Opposed, no. Motion is approved. Other recommendations, committee? Representative Carpenter, we should just have you just go down your list.
Yeah.
You should. I mean, and I have no problem with that, Mr. Chairman. So, fully rebase nursing homes daily Medicaid rate. This amount is included in caseloads. The total amount for a 9.6% increase is $71 million all funds, including $28.7 million SGF. Fall caseloads included a 5% increase. This would be in total 10%.
Committee, you've heard the motion. Second by Representative Hobson. Discussion.
May I elaborate?
Yes, please.
So, both Folks, whether we like it or not, our nursing homes, and we all have nursing homes in our district, our nursing homes are not in the best of shape. They've survived COVID. They're in the middle of all kinds of wage and help issues and that kind of stuff, and they need our help, or we're going to have to figure out where we're going to put these folks here in a few years, and that's just point blank.
And more nursing home business models are becoming more and more reliant on Medicaid patients. So as that balance shifts, then the need to do this and to help our long-term care homes, particularly in rural areas, is eminent. Committee, other discussion? Representative Ballard?
Thank you. Just the amount of, the amount, again, I was looking for it and I missed the amount, please.
It was 7.2 and 28. I've got 28.7.
So 71.9 million all funds?
Yeah.
28.7 SGF?
Uh-huh.
Okay. Committee, other discussion? Representative Clifford?
Is this allotted on the percent of Medicaid patients that the facility has? I know we heard some testimony about some have 80% plus and some have 50%. Is that how this would be allocated?
Yeah, if you'll stay tuned, I'll take care of that one too.
Thank you, Representative Carpenter. Thank you, Mr. Chairman. I'm still tuned.
Me.
And I didn't mean that to be.
No, my headaches is going away.
Hold on, I've misspoke here on the totals. The government has half of it in her budget, basically, so I'm only recommending the other half, bringing it up to 10%. And we'll get the correct numbers here in a minute.
Is it 34.4 and 14? Is that the correct number?
Yep, that's it. So I would amend my motion to include those numbers instead of,
Okay. So we're talking 34.4 million all funds, 14 million SGF. Is that
Correct.
okay with the second?
right.
Okay. Committee, further discussion? Seeing none. Representative Carpenter.
I close.
Committee, you heard the motion by Representative Carpenter to amend. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion passes. Representative Carpenter.
Thank you, Mr. Chair. Increase of frail and elderly waiver reimbursement raised by 10%. It's 13 million, all funds 5.2 million SGF. The frail and elderly waiver is vital for us to keep folks in their homes and receiving services and not going to nursing homes. And they have had difficulty, much like nursing homes and all the rest of them, of covering costs and hiring employees.
Representative Ballard seconds. Committee discussion. Representative Barth.
It was 5.2 SGF, 13 million all funds.
Representative Clifford.
Thank you, Mr. Chairman. We had testimony that asked for matching the BIPD, TA, and autism waivers to the frail elderly. So is this going to shift that ask because we're rebasing
Yes, it
the
is.
fee?
And
Stand by again, right?
in a perfect world, we would match all the waiver rates, and I get that. And I don't know what else to say about it. I have no defense of that, except for it's probably about a $50 million hit.
Thank you. Thank you, Mr. Chairman.
Committee, further discussion. Seeing none. Representative Carpenter.
I close.
You've heard the motion by Representative Carpenter to amend. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion is approved. Okay. Representative Carpenter.
Thank you, Mr. Chairman. And I do have one here that is not going to cost anything. So how's that? Add language to require KDADs to conduct a study to review the ID service provider's cost and provide recommendations to adjust the fund based on inflationary indexes.
Second by Representative Hobson. Discussion on the proviso? Any discussion?
It's not
Representative-
costing anything.
Representative Carpenter.
I close.
You've heard the motion to amend with a proviso. All in favor? Whoop. Representative Barth, I'm sorry.
Sorry, I was reading, I just had a little bit for discussion, if you don't mind.
I beg your pardon?
For discussion
Yes,
on this?
yes, please.
Thank you, Mr. Chair. Does this also look at the positions in addition to the cost, like if we have too many positions, or, look at the number of positions that we have as well as looking at the cost?
Well, I'm not sure who will be on the interim committee, so it will be decided by, the depth of that will be decided by the interim committee chairman as to what he wants to cover, but I would envision that it would be a deep dive into how we pay the ID and the DD providers and how it's sufficient for them to provide the services that we require them to provide.
And was this, where was this on the list? I'm just trying to find the supporting sheet that went with it, with the request.
Yeah, I'm not sure that this is, oh, it is on our list. It's on the second page down.
Third from the bottom.
I'm on the second page. It's like third from the bottom on that.
Any other discussion? Seeing none, Representative Carpenter.
I close.
You've heard the motion by Representative Carpenter. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion passes. Representative Carpenter, you have another?
I'm almost done, sir. Okay, this is going to cost some money. Add 61.6 million, including 24.6 million SGF to fund a Medicaid payment add-on to distribute per Medicaid resident based on the percentage of Medicaid residents as reported on a facility's annual cost report. So, may I elaborate, Mr. Chairman?
Yes, please elaborate.
So this is to address what you just talked about. We have nursing homes out there that are, and we heard testimony about that have 90, 95% Medicaid and a variety of in between. In the old days, we used to have a lot of private pay folks that they charged more. Private pay $300 a day, $311 a day. We pay $200. So in the old days, they got enough private pay in there that they could offset those costs. Well, as we see in a lot of these nursing homes now, when we're talking 80, 90% Medicaid, then they're not getting that private pay to offset those costs. And so it's becoming a real issue, especially in the rural communities.
I'll second.
We have a second by Representative Ballard. Committee discussion, Representative Clifford.
Yes, thank you, Mr. Chairman. I wonder if this might need to be studied, because I think, citizens are impoverishing themselves in addition to the folks who already are impoverished enough to qualify. And as we baby boomers age into this need, it could be a tsunami of funding required. So I don't know if there's a study proposed or Representative Carpenter would address that for the future years.
Representative Carpenter.
Thank you, Mr. Chair. That will be a recommendation. Later on, recommend an interim committee to study setting methodology for nursing homes. And I agree 100% with you, Representative Clifford. This is a nightmare, and every year I get up here, last year I think the hit was $50 million. You know, I mean, but it's, again, it's a necessary deal. I don't particularly enjoy being in this position, but I also look down the road 5 to 10 years. We close these nursing homes, more than likely they're never going to open again. Nobody's going to capitalize up to run a nursing home. And I know a lot of us have had face closures in our areas and in our towns. And I'm just trying to keep them alive until we can get some kind of a solution to the funding source. And I think an interim study on that is exactly what we need, much like we did last year, to try to dig into how are we funding them, what, you know, what the projections. I mean, I've seen remarkable change in Medicaid patients from just in the last 5 years, you know, where it used to be 40% private pay, and now we're looking at 80, 90% Medicaid. And so it's critical, and I agree.
Thank you, Mr. Chairman.
Committee, other discussion? Representative Ballard.
You know, when I look at this and we think about it, it is 61 million, all funds, but 24.6 million. And when we're looking at it in terms of, in the next 10 years, the 65-plus population in Kansas will increase by another 208,000. And that number will continue to grow as the 85-plus population increases by triple digits. The vast majority of these senior Kansans will need long-term care services and supports at a time when our state needs to be growing long-term options and investing in a senior care workforce. We are instead contracting in every direction. I will just simply say I'm helping a friend right now in Lawrence, Kansas, to try to find a place that she and her brother will agree is a nice place for their mother. And they found the place, but there's no vacancies. And they looked at 30 different homes between, you know, Johnson County and Lawrence, and they could not find. There were some available, but they weren't satisfied with them, and they can pay, so they don't have to, you know, they can supplement, I should say, her. But they're having a difficult time. Well, if they're having a difficult time in 2023, finding these places, and we know some of them are closing now, what are people going to do when they have to put their mother or their dad or their wife or their husband there? And I think it's up to us to try to develop something out there so that there are homes and there are people that will be working those homes to take care of the people that we really care about.
Committee, other discussion? Seeing none, Representative Carpenter.
I close.
Committee, you've heard the motion to amend. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion is approved. You have another, Representative Carpenter?
Two more, Mr. Chairman. I promise you that I am out of here in this.
Reminds me of when we did the KDHE budget, and it was my turn.
Yeah, exactly.
Please
So,
proceed.
anyway, Representative Clifford stole my thunder over there, but recommend an interim committee on rate-setting methodology for nursing homes as a recommendation. I think we've already kind of discussed that issue, but I would certainly, any questions anyone had, I would certainly answer.
We have a second on that. Representative Hobson. Committee discussion on that motion? Seeing none. You may close, Representative Carpenter.
I close.
You've heard the motion by Carpenter to, Representative Carpenter to amend. All those in favor signify by saying aye.
Aye.
Opposed, no. Motion is approved. Representative Carpenter.
Thank you, Mr. Chair. I saved the best for last. This is a amendment adopting the community support waiver and requiring KDADs to apply for that when our current waiver expires in 2024. Many of you sat on that committee. We had a great committee. We dug down into it. And this basically, it has a $20,000 cap, and the services that are provided will be off of the report that we did. There's services, transportation, supported employment, individual directed goods and services, personal care, respite, therapy, assistive technology, independent living, family caregiver support and training, financial management services and support brokers and benefit counseling. What KDAD's, and thank you, Brad, for that, they put together a great deal, and the rollout arguably it'll be 2 years and maybe longer, depending on how long it takes to apply for that waiver. But the first rollout is 500 participants in year one, $20,000 cap. It's $10 million all funds, including $4 million SGF. This is not in the budget. This is just, I'm just explaining to the committee what this could involve in year two, 1,000 more, a $20,000 cap, and an eventual $20 million all funds, $8 million SGF into the future when this waiver is applied for and approved by CMS. We had 7 states come to us and testify. This is not reinventing the wheel. Many states are already using this and trying to address their wait lists. While we're talking about wait lists, we have almost 5,000 people on wait list services. They're waiting for services 10 years. So when a 5-year-old, which is when you're eligible for that, a 5-year comes on, the first time he will be eligible for services when he's 15. That, in my book, is not acceptable in our state. It's just not. Think about how much with therapy and things like that we could have improved that child's life during that 10-year period that he's waiting for services. So anyway, with that, I'll stand for questions, Mr. Chairman.
Couple questions, Representative. This, the community support waiver would replace the 1115 waiver, is that right, at the end of its life?
It will not.
It will not.
It will be ongoing. And so there may be folks that are on the 1115 waiver that we have now that don't need. On the 1115 waiver that we have in place now, we require 13 services. And we have to have the money to pay for that before we put someone on there. But a lot of folks may only need 1 or 2. We heard amazing testimony of people. A lot of these folks have been taking care of their kids or their family member for their entire life. And all they need is somebody to come in on Friday to take care of their child or their loved one or whatever and go shopping or go out to dinner or something like that. A lot of them, and they're just fine taking care of them day to day, and they've been doing it for years. But they are reaching, a lot of them we find are getting elderly, and they're not able to take care of at the same rate that they were when they were younger. And so, but this won't replace our current waiver. But I do believe that it'll take, folks could go off of that and come on to the waiver light or the support waiver, whatever you want to call it.
So as I understand it, then the motion to amend with the proviso just directs the department to apply for the community support waiver.
That's right.
Okay. And Representative Ballard has seconded.
And it's about a quarter of a page long, and I didn't want to bore the committee with reading it. So it's a very detailed.
You could have said blah, blah, blah. Yada, yada, yada. Okay.
I could have.
Committee discussion on this, on the motion. Representative Barth.
Thank you, Mr. Chair. Just a quick question for you. The $20,000 cap, that's for per individual up to 500 people year one. And then is this until they get the the next waiver then, or is this?
No, this is a standalone waiver. It'll run right beside it.
Okay,
So it won't affect, I mean, it could not, maybe not affect anybody that's on the current waiver, but it would be taking people, the 5,000 people that are on the wait list, it would take people from that to move it on to the community support waiver.
and is the process going to be the same to look at who comes off that waiver or that wait list that would get this
It
type of
will be.
waiver? Same-
KDAD does extensive testing and reviews and all that kind of stuff. And that's, maybe if you're going that direction, that's maybe for another day. Whether we use MIFI or, you know, we had a lot of discussion over, Representative Cliff, over how we evaluated folks that were on the waiver. And so I've kind of remained.
And this is what is it, like close to almost 5,000 people that were on this wait list? Is that right, I think, for the?
That's how many are on there now, 4,800 and something. We take about 250 off every year through attrition, and some of them, a lot of it's death or whatever, but we do take about 250 off of the wait list. But the wait list seems to be outgrowing the, how many people we take off, quite frankly. And a lot of that is because, you know, and it doesn't take a rocket science to figure this out, their healthcare needs are better. They're taken care of. They're living longer. It's just that simple. I'd venture to say in the last 20 or 30 years, their life expectancy has expanded by 20 years. I had that number. I don't remember. But anyway, they're living longer, and we're having to take care of them longer. It's just that simple.
The maximum would be 10 million then, at the most, additional funds needed?
Well,
Assuming they don't all use, you know, not every.
well, and we don't know, because some of them may only use $200. You know, I mean, we don't know what, but in interest, and I can't believe this is going to come out of my mouth, this, in the interest of being fiscally responsible, we put a $20,000 cap on it. So I'm not, anyway, it's a joke.
And this particular motion does not have a financial component attached to it. It is just directing the agency to pursue that waiver. Representative Ballard?
Maybe we need to also know that this is the waiver that may take 2.5 to 3 years for us to get, because by the time we figure out what we need to do and we submit to CMS, you know, Committee on Medicare and Medicaid, it'll take a while. But when we get that, I think it will make a big difference, because you don't have to meet all of their needs. You have to just meet the ones that they need right now, and which allows us to treat more people also.
Mr. Chairman.
Representative Carpenter?
Well, just for instance, and you wouldn't think of this, one of the major needs was transportation. You know, they're not able to drive, so, you know, getting back and forth, and many of them have jobs, but they need transportation of some type to get back and forth for a job. So that was really high on the list that we found of services that they wanted, was transportation. You wouldn't think that would be high on the list, but it was right up there at the top. So anyway.
Committee, further discussion on the Carpenter amendment? Representative Clifford?
I wonder if Representative Ballard or Carpenter would remember the cost of the full waiver. I mean, the 20,000 cap is a savings, because somebody on the full waiver is 45,000, 63,000, 80. It's a
I think
big number.
It was 48, I think, the last time I checked, but it could be up to 50,000, providing one person on the full waiver of 13 services. I think last year when I pulled those numbers, it was like 48,000. Dayton, do you have anything? Never mind. But it is very expensive.
Thanks for that answer. Thank you, Mr. Chair.
Further discussion, committee? Seeing none. Representative Carpenter?
I close. Thank you for your indulgence, Mr. Chairman.
You've all heard the motion by Representative Carpenter to amend with this proviso. All those in favor indicate by saying aye.
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 Opposed, no. Motion is approved. Representative Ruiz?
more recommendations. I have a question on this, and I don't know if, who might be able to help. Representative Carpenter was just talking about like the transportation services. We do have the chance here, I guess, to increase reimbursement rate for supported employment in the transportation services, because Representative Carpenter is correct. There are many people that work or want to work, but transportation is a big issue, but being able to increase that reimbursement rate. However, I don't know what the rate is now. No, the rate, yeah, reimbursement rate, to know where to raise it to.
Representative Carpenter.
You're talking about supported employment. I think it's about $13 an hour, if I'm not mistaken.
I didn't see where we could raise it to. There was an ask, but there wasn't really a dollar amount attached to it as to what we could raise the rate to and what that fiscal impact would be.
Clarify who asked for it.
The Disability Rights Center did for sure.
Yeah, the ask was a little bit vague, I think, so I'm not sure. Representative.
So it looks like KDAD's did an estimate of increasing it to $47.80. So I'm not sure that $13 was correct. Same thing. Without having, I guess, having those figures, I don't have a good way of making the recommendation for it.
Committee, are there other recommendations for fiscal year '24? Last call. Representative Clifford.
Yes, Mr. Chairman, I'd like to seek an enhancement of $3 million for fiscal year '24 for the community mental health centers to cover uninsured and indigent care.
Representative, is that on the first page of our cheat sheet?
Yes, it is, Mr. Chairman.
Okay. All right, you've heard the motion by Representative Clifford. Is there a second? Yes. Representative Ballard seconds. Committee, discussion? Seeing none. Representative Clifford?
I close.
Committee, you've heard the motion by Representative Clifford to amend. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion passes. Further recommendations, committee. Representative Ruiz.
Mr. Chair, I recommend adding $5 million to increase allocations for the substance use disorder services for the uninsured. We heard from Behavioral Health Association, the Coalition, Kansas Mental Health Association. You know, we're just seeing an increase in substance use across the state, and many folks don't have insurance to really help pay for that. So to help with the unreimbursed services.
Okay,
I'll second, Mr. Chairman.
Representative Clifford seconds. Committee, discussion on the recommendation. Questions? Seeing none. Representative Ruiz.
I close.
Committee, you've heard the motion by Representative Ruiz to amend. All those in favor indicate by saying aye.
Aye.
Opposed, no. Motion is approved. Further recommendations, committee? I'm seeing none. I would entertain a motion to pass out the budget for fiscal year 23-24 as amended. Representative Ballard
Second.
moves.
Clifford
Second by
seconds.
Representative Clifford. Is there discussion on this? Seeing none, all those in favor indicate by saying aye.
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 Opposed, no. The motion, or the budget is passed. I just feel like we won the Price is Right shopping. Okay, now all we got to do is defend it to appropriations. Committee, we have a short hearing tomorrow, and that will be the last meeting for us for quite some time. So I appreciate a great engaged committee, and I appreciate every one of you. Representative Hobson.
When you said it was for quite some time, what's the process? Is we have to wait for the Senate, or how does it work? I mean, I'm saying, what's the process in terms of when you say we're not going to meet for?
The process from
In terms
here,
of we're waiting for the, yeah.
I'll report this budget out on roughly March 8th to the full Appropriations Committee, and then that's where they throw darts at me. So
We have to wait for the Senate.
so the process is for us to defend it, and
Okay.
the ranking member and I will be there to defend this, and of course that committee can make any motion they wish to change or delete or whatever. So we might see that, but that will be the next step, is for us to defend this, and then it would be part of the budget. It would go to the the full House, and et cetera.
Thank you, Mr. Chairman.
Any other questions? So as I say, we have a short hearing tomorrow, and then I think we are pretty much done. But I do want to thank you all for being engaged and being a great committee. Thank you very much, and meeting adjourned.